topic of discussion is on cardiac cycle. Cardiac cycle, one cardiac cycle equal to one systole plus one diastole. Systole means contraction and diastole means relaxation. If we talk about definition, then we must define cardiac cycle properly. That is, let me write changes that occur in one heartbeat are repeated in the same order in the next beat, in the next beat. This cyclical repetition of the various changes in the heart from beat to beat is called cardiac cycle. मैं ये कहना चाह रहा हूं कि एक कार्डियक साइकिल मतलब एक सिस्टोल होना है और एक डायस्टोल होना है. सिस्टोल का मतलब ये है कॉन्ट्रैक्शन और डायस्टोल का मतलब है रिलैक्सेशन. हार्ट में क्या होता है? हार्ट, इफ वी ड्रॉ द डायग्राम ऑफ द हार्ट, it will have right atrium, then left atrium, right ventricle and left ventricle. We are talking about systole of whole heart and diastole of whole heart. एक सिस्टोल होना चाहिए और एक डायस्टोल, दोनों मिला के हमारा एक कार्डियक साइकिल बनती है. ड्यूरेशन ऑफ वन कार्डियक साइकिल is 0.8 second. Duration of one cardiac cycle is 0.8 second. Means, if we talk about, again it is one systole and one diastole. One systole of atria and systole of ventricle, diastole of atria and diastole of ventricle. Again, another way also we can say cycle present in the atria called atrial cycle, present in the ventricle is called ventricular cycle. So atrial cycle if we talk about, the duration is 0.8 second, and ventricular cycle is also 0.8 second. Means atrial cycle means atrial systole will be there and atrial diastole will be there. मेरे ख्याल से समझ में आना चाहिए. मैं वही चीज को बार बार दोहरा रहा हूं. ये जो एट्रियल साइकिल है इसकी ड्यूरेशन 0.8 सेकेंड एंड वेंट्रिकुलर साइकिल 0.8 सेकेंड. इन एट्रियल साइकिल एज ऑलरेडी आई हैव मेंशन, एक साइकिल मतलब एक सिस्टोल होगा और एक डायस्टोल होगा. तो एट्रियल साइकिल अगर हम कहें तो एट्रियल सिस्टोल भी होगा और एट्रियल डायस्टोल होगा. एट्रियल सिस्टोल का ड्यूरेशन जो है इट इज 0.1 सेकेंड और डायस्टोल जो है इट इज 0.7 सेकेंड. और ventricular systole the duration is 0.3 second and ventricular diastole the duration is 5 second. उसके बाद हमें क्या लिखा है, changes that occur in one heartbeat. एक हार्टबीट में जो भी चेंजेस होती है एक हार्टबीट में, वही चेंजेस हर हार्टबीट में होता रहता है. Changes that occur in one heartbeat are repeated in the same order. In the same order मतलब पहला सिस्टोल होगा फिर डायस्टोल होगा, फिर सिस्टोल होगा फिर डायस्टोल होगा, फिर सिस्टोल होगा फिर डायस्टोल होगा. Repetition of the various changes in heart from beat to beat is called cardiac cycle. This cyclical repetition of the various changes in heart from beat to beat is called cardiac cycle. Now, if we draw another diagram, say this is the circle. Here this is the outer circle and another is, say this is the inner circle. So two circle I have made. Since the total duration of the cardiac cycle is 0.8 second, then this circle can be divided into 8 equal subdivisions. This is the meridian and equally we can divide this cycle. It is equally divided from one to another. It is 0.1 second. From one meridian to another meridian it is 0.1 second. मतलब एक जो हमें मिला है, इस एक का ड्यूरेशन जो है 0.1 सेकेंड. तो here first if we start with atrial systole, this inner circle represents atrial event and outer circle represents ventricular event. जो इनर सर्कल जो मैं दिखा रहा हूँ ये एट्रियल सिस्टोल है एंड डायस्टोल है, और आउटर सर्कल जो है also it is ventricular systole and ventricular diastole. So if we want to correlate the atrial event with the ventricular event, then we must draw this diagram. Say this is atrial systole because already I have told you this is atrial systole because duration of atrial systole is 0.1 second and rest is diastole. This is the 0.7 second. This is the atrial diastole. This cavity it represents atrial diastole. So this is the total 0.8 second. And then as soon as atrial systole over ends or terminated, the ventricular systole starts. So this is the 0.3 second. This is 0.3 second is ventricular systole, and rest from this to this it is ventricular diastole. So this one actually ventricular diastole, and this ventricular diastole is 0.5 second. This ventricular diastole is 0.5 second. So in this circle, what I am going to tell you, I am trying my best to bring a correlation between atrial event and ventricular event. Atrial event, if we talk about, this is the inner circle, first atrial systole followed by atrial diastole, and then as soon as atrial systole is over, there is a ventricular systole 0.3 second, and after ventricular systole, ventricular diastole starts. So again, if we look at the definition I have told you, that changes that occur in one beat, in one heartbeat, are repeated in the same order in the next beat. सेम ऑर्डर, एक बार खत्म हो गई, फिर से सिस्टोल होगा, फिर वेंट्रिकुलर सिस्टोल होगा, फिर वेंट्रिकुलर डायस्टोल होगा. So this type of repetition of various changes taking place from beat to beat, that is called cardiac cycle. So ऐसा नहीं है कि ये सिस्टोल हो गया फिर डायस्टोल होगा, फिर सिस्टोल नहीं होगा डायस्टोल होगा, ऐसा नहीं है. The duration is remain fixed and the events in this cycle also remain fixed. There is no alteration. पहले सिस्टोल होगा फिर डायस्टोल होगा, उसके बाद ऐसा नहीं होगा कि पहले डायस्टोल होगा उसके बाद सिस्टोल होगा, ऐसा नहीं है. पहले सिस्टोल होगा, that is atrial systole, in a cyclical manner, and that is why this is called atrial cycle, the innermost cycle, and outermost cycle is ventricular cycle. Now let us discuss what is atrial systole. What is atrial systole? Cardiac cycle I will define in a two ways. First, I will give you diagrammatic representation, and then I will give you graphical representation. So cardiac cycle, I will explain all the events first diagrammatically and then I will represent graphically. So let us start with diagrammatic representation. Now it is atrial systole. Here this is the atria. Atrial systole means this diagram showing the atria, left atrium, and this is left ventricle, and this is aorta. In every situation, as for example, अभी हम क्या डिस्कस कर रहे हैं? एट्रियल सिस्टोल. तो हर इवेंट में हमें ये बताना है व्हाट इज द स्टेटस ऑफ लेफ्ट एट्रियम, व्हाट इज द स्टेटस ऑफ लेफ्ट वेंट्रिकल, एंड व्हाट इज द स्टेटस ऑफ एवरा. These three chambers, as you all know, whatever happening in the left heart, the same thing is happening in right heart. So I have taken left heart in this diagram, only left side of the heart. So left side of the heart में क्या क्या है? Left atrium है, left ventricle है, और aorta है. So in every situation, I have to talk about what is happening in the left atrium, what is happening in the left ventricle, and what is happening in the aorta. Now let us start with atrial systole. The duration of atrial systole is 0.1 second. Now in this what will happen? Here as soon as it will start contracting, then what will happen? The valve will be opened, the blood will enter into the left ventricle. Now what situation we will find in the left ventricle? Already 80% of ventricle is already filled. Before atrial systole, already 80% of the ventricle is already filled. So rest 20% has to be filled with atrial systole. So as soon as there is a contraction, so the blood which present in the left atrium will move to the left ventricle. And what is the situation here? The situation, this valve remain closed. This will remain closed. Which valve it is? It is pulmonary, sorry, it is the mitral valve. Mitral valve. And here it is bicuspid valve. Bicuspid valve. So there will be an opening of the valve. The blood which is present here will move towards the ventricle, and this 20% of the ventricle will be filled due to this contraction atrial systole. And what is the pressure here? The pressure in the left atrium here will be increased. If we draw the diagram of the pressure here, say this is the pressure in the left atrial pressure will be increased here during systole. The pressure increases, say it is 5 millimeter of mercury or 6 millimeter mercury. The pressure will be increased here because of this contraction, and as a result the pressure which is more as compared to the pressure in the ventricle, here it is pressure 0 millimeter of mercury. So because of this difference, all blood will move from left atrium towards the ventricle. And what is the status here? Here status is the diastolic pressure is 80 millimeter of mercury. So there will be no change with this pressure. Now coming to the next is ventricular systole. The next is ventricular systole. So here, if we draw the diagram of ventricular systole. Let me draw the diagram of the ventricular systole. So the ventricular systole, here it is the ventricular systole. Now here I am drawing the diagram of the lungs. This is the lungs, and the blood will start entering into the left atrium. So if we talk about status in the left atrium, then what will happen? This valve will be closed. So because of this, there will be a sound. We call it fast heart sound. There will be a sound. We call it fast heart sound. And again, this will be closed. This will be closed. Again, this will be closed. We are talking about ventricular systole. First stage, that is in ventricular systole, if we talk about, that is isometric contraction period. Isometric contraction period. Then maximum ejection period. And then the reduced ejection period. Reduced ejection period. Isometric contraction period, the duration is 0.05 second, and this is 0.11 second, 0.11 second, and this is 0.14 second. Look at the different phases I have mentioned here. Ventricular systole हम बताने के लिए जा रहा है. Ventricular systole में 3 फेज होती है. फर्स्ट जो है, इट इज आइसोमेट्रिक कंट्रैक्शन पीरियड, दैट इज 0.05 सेकेंड. देन मैक्सिमम इजेक्शन पीरियड, दैट इज 0.11 सेकेंड, and then reduced ejection period is 0.14 second. So first is the diagram I have drawn here. It is the isometric contraction period. Isometric contraction period, here the muscle will start contracting. So first there will be a closing of atrioventricular valve, or which valve it is? It is bicuspid valve. This closing of this valve will give us a sound, that is we call it first half sound. क्लोज हो जाएगी, ये भी क्लोज तो है ही, तो इसमें जो 0 मिलीमीटर ऑफ मार्करी का प्रेशर बरकरार था, कहाँ पे? एट्रियल सिस्टम में. नाउ दिस प्रेशर विल गो अप 5 millimeter of mercury, say it is 79 millimeter of mercury, because of isometric contraction period. So there will be a sudden quick change with the pressure. देखो 0 millimeter mercury था, जैसे ये भाल बंद हो जाती है, कॉन्ट्रैक्शन शुरू हो जाती है, तो इस चेम्बर जो वेंट्रिकल की बातें कर रहा हूँ, द प्रेशर will be gone high, and that is 79, means here pressure is 80 millimeter of mercury. Already I have mentioned this is the aorta, this is the aorta. So aortic pressure is 80 millimeter mercury. Here the pressure is 79 millimeter mercury. In which period? Isometric contraction period. And the blood, here what situation we will have? This left atrium will start filling with the blood. Blood is coming from the lungs through pulmonary vein. So this blood will start entering into the left atrium. Now the next is the maximum ejection period. So maximum ejection period, if we draw the diagram of maximum ejection period, so what will happen? Maximum ejection period, this valve will be opened, and here this will remain closed. So this is left atrium. Here we have the lungs. Here we have the lungs, and the blood will enter into the left atrium. So this is the diastolic phase. This is in diastolic phase. So the left atrium will accept the blood from the lungs, and this is the ventricle. This ventricle pressure will be more than the aortic pressure. So if it is 81 millimeter mercury, this valve will open. This valve will be open, and what will happen? The blood will enter into the aorta. So there will be a stretching with the wall of the aorta. So blood enters here. Now pressure, if we look at 81, 85, 90, so that will be more than the pressure in the aorta. So easily blood will come. The duration of this maximum ejection period is 0.11 second. And the next diagram, if we talk about, so this is the next diagram I am talking about. What will happen? This is the valve. This valve will remain open, and there will be a slowly the blood will enter into the aorta. This will be closed, and here again it is the lungs, and the blood will enter into the atrium. So here it is in relaxation phase, it is in relaxation period. So blood will keep coming and enter into the left atrium, and the blood which present here, it will be ejected, it will present in the aorta. It will be entering into the aorta. In which phase I am talking about? That is reduced ejection phase, and the duration is 0.14 second. This is 0.14 second, and this is 0.11 second. So this is maximum ejection phase. Maximum means large amount of blood will enter into the. How much blood enters here? In one stroke volume, how much blood enters into the aorta? It is 70 milliliter. So the 70 milliliter, maybe in this maximum period, maybe 50 milliliter blood enters here, 50 milliliter, and rest 20 milliliter will blood enter into the aorta. So what will happen? In this, the blood will enter into this phase, but still there will be a blood present in this. After reduced ejection phase, some amount of blood will remain here, and that is called end systolic volume. End systolic volume. And this volume is so here, now coming to the next is, this is ventricular systole, isometric contraction period, maximum ejection period, and this is the reduced ejection period. Come to the ventricular diastole, ventricular diastole. So here what will happen? Ventricular diastole. This is the ventricular diastole. First is isometric relaxation period. Isometric relaxation period. In this, here there is a relaxation. This is right atrium. There is a relaxation of this, and here it will start relax. There will be a relaxation of the ventricle. Now, because of this valve will be closed. Why this valve will be closed? Because here the pressure is 80 mm mercury, and here the pressure is less than 80 mm mercury. So what will happen? There will be no backflow of the blood. So this valve will be closed, and because of this closing of this valve, a sound will be produced, and this is called second heart sound. So at the initial stage of ventricular diastole, there will be a protodiastolic period, and in this we will see the relaxation with the ventricles, and again this is called isometric relaxation period. Isometric relaxation period. And the duration of this isometric relaxation period is approximately 0.1 second. Isometric relaxation period. This ventricular muscle will start relaxing. Once it is relaxing, the pressure will be dropped, and it is dropped such a way the pressure will be less than the aortic pressure. So this valve will be closed. And here what will happen? In this also, what we can see, this is the lungs, and the blood will again, in this chamber, blood will enter into the left atrium. And here what will happen? This will be a closed chamber. And what will happen? This phase is called isometric relaxation period. Now the next is filling phase. First rapid filling phase. The diagram, if we draw, it is this is the lungs. The blood will come here, blood will enter into this, and this will be closed. So this is the aorta. I am talking about first rapid filling phase. First rapid filling phase. The duration is, first rapid filling phase, the duration is 0.113 second. 0.113 second. Filling of this ventricle takes place here, because pressure is gone down here because of the relaxation. Here it is because of the relaxation, the pressure in the ventricle comes down. Even the pressure is such that which is less than the pressure in the left atrium. So the blood will move towards the ventricle. So this will be opened, and the blood will enter into the left ventricle. So already blood was there, and then again there is a filling, first rapid filling. Then the next is if you draw the diagram, next is Diastasis. Next is diastasis. Diastasis. The duration of this is diastasis is 0.167 second. 0.167 second. So what will happen? In this also, this is the lungs. This is the lungs. The blood will enter here, and again the blood from this will remain closed. So the blood will keep entering into the left ventricle, but the movement will be slow. Slowly this ventricle will be filled. Slowly ventricle will be filled. This is the end systolic volume. This will remain, and again the some amount of blood. Here the blood is filled here, blood is filled here, blood is filled here, blood is filled here. The last phase is if we want to draw the diagram here, then I must remove this much. So if we want to draw the diagram here, so here the lungs is there, blood is coming, entering into this, and here it is the last rapid filling phase. This phase is last rapid filling phase. Last rapid filling phase. Here in this phase, last some amount of blood will be filled here, and this volume is called end diastolic volume. End diastolic volume. So how much volume we are expecting here? Stroke volume, that is 70 milliliter, plus some amount remains always. So that is the 60 milliliter. So total volume is 130 milliliter. So this 130 milliliter is the end diastolic volume. Now again, if I repeat, now the next is atrial systole. After it is filled, we again will look at the event, that is atrial systole. So if we diagrammatically explain the cardiac cycle, I have started with atrial systole, then ventricular systole. So there are three phases of ventricular systole. One is isometric contraction period, then maximum ejection period, and then reduced ejection period. Here the duration is 0.05 second, and here the duration is 0.11 second, and here the duration is 0.14 second. So this ventricular systole is 0.3 second, 0.05, 0.11 and 0.14. ये तीनों को आप मिला देते हैं, so it becomes 0.3 second. तो ventricular systole के बाद ventricular diastole हमने explain किया. Ventricular diastole I have explained. Ventricular diastole. Here the ventricle will start filling. First is isometric relaxation period. And here we have the second heart sound, and then we have first rapid filling phase, then we have diastasis, and then we have last rapid filling phase. Now here one thing I would like to say here, the blood, when it is in the diastasis phase I am talking about, the blood is moved, blood enters here, and in this phase we will have a sound, and that sound is not easily heard in normal individual. This sound is called third heart sound, and another sound in last rapid filling phase also there will be a sound. We can that sound can be heard in affected person, in the person having the hypertrophied ventricle. In that patient we can hear this sound, and that is called fourth heart sound. So this is the graphical representation. So this is the diagrammatic representation of cardiac cycle. Now come to the graphical representation of cardiac cycle.